Much of how doctors treat prostate cancer comes from previous studies about genetics and a man's genes, mostly dealing with white men. Well, now the largest study of prostate genomics in black patients just concluded. And joining me to talk about the findings is one of St. Louis's best urologists. It's Dr. Christopher Yeager of Urology of St. Louis. Good morning, Doc. How are you?
Hey, good morning, John. How are you?
Fantastic. Good to see you again. Now, this study was done at UC San Francisco and Northwestern University. And tell us about what you found from this study that you find interesting.
Well, I think that the most important thing that comes out of this study is just the concept that we can now target therapies, and this is called precision medicine. We're entering into a new phase of cancer therapy where we can start to actually specifically target cancer cells and based on a patient's genes or the mutations that happen in their DNA.
Which creates all of that diversity with prostate cancer. And specifically, 1 of every 6 black American men will be diagnosed with prostate cancer in his lifetime. And of these men, they are twice as likely to die from the disease as men of other races. And from this study, which consisted of 600 men, you can now target, perhaps in the future, more specifically for these men?
Yeah, I think it just offers us, again, just a more specific look. We are not just trying to hit every nail with a hammer here. We can specifically figure out who is at higher risk for aggressive prostate cancer and even use some targeted therapies for specific patient populations that will hopefully improve overall survival and improve men's quality of life.
Now, when you talk about therapies, are you talking about radical prostatectomies or, for example, drugs?
Yeah, I think we'll see more drugs come into the market based on some of these findings with gene therapies and targeted therapies rather than surgical or procedural management or even radiation therapies. We'll probably be finding more gene therapies come into the market and more either chemotherapies or genetic treatments that are available in the next couple of years.
Yeah, and for some men, it comes down to access to better health care. How does St. Louis Urology reach out to those who, say, may not have access?
Well, we just encourage you to have a conversation with your doctor. If you don't have access, there are different ways to get screening. There are free screening clinics sometimes throughout the region. All it takes is a PSA test and a conversation with a doctor.
Dr. Yeager, good to see you again.
You too.
And for more information on this study and to get a health assessment, we do have a link to St. Louis Urology. It's on our website at fox2now.com. It is 7:50. We're going to take a break. We'll be right back with more Fox 2 News in the morning at 7 right after this.